and people can jump in as they get on. So welcome everyone. I'm Therese Hauk, and I'm a nurse, and I also teach yoga at Mesa Fitness, at least I used to, but we'll be back soon. And I want to welcome everyone. I am not an animal owner. I love animals, and as a child, I can remember always, you know, when you get to wish on a star, or you have a birthday and you get to blow all your candles out and make a wish. I mean, I always wished for a horse. And so I love horses. I was a city girl. I, was raised in a blue collar city, and I had 5 siblings, so there was no way I was ever going to have a horse, but I sure wanted one. And I read all the books I could on horses. I just loved horses. So I'm just so excited now that I am interacting with some people who really are very involved with horses and animals. And we've put together this presentation tonight to look at optimizing horse health and happiness through nutrigenomics. So I'm going to go ahead and share my screen right now. So, and we're going to look at some slides, not here. You don't want to see that. Okay, here we are. And so we're going to be talking about biohacking. And I'm just going to explain some of these, kind of big terms before we dive into talking about animals specifically. And the first term that I want to talk about is nutrigenomics. So what is nutrigenomics? It's kind of a fancy medical word, but it's actually, if you break it down, it's actually very simple. I mean, nutra meaning nutrition, what we eat, what supplements we take, and then genomics is our gene makeup, our genetic expression. 20 years ago, we didn't know that we could affect our genetic expression by what we eat. And in the last 20 years, there has been research that shows that the foods we eat, sometimes the supplements that we take, can actually upregulate or downregulate our genes, which is a burgeoning field. It's so exciting to me. And so with the same can be true for animals. An animal that has a predisposition for cancer, we can downregulate those genes so that maybe they won't develop cancer. And so another big term that we talk about is biohacking. So, our bodies, not just our bodies, but, any animal body is being hijacked on a daily basis. For humans, we're exposed to biochemicals, EMFs from our cell phones. We have allergies, but animals are exposed to some of this stuff too, but they have a different level or different exposure than what humans do, obviously, versus biohacking. And so hijack means, we have no control. Biohacking is where we are taking control of what our biology is and optimizing our genetic potential. And we biohack our bodies by using nutrigenomics. So it's a very powerful concept, and I want to go ahead and turn the meeting over now to Dr. Janet Gordon-Palm. And so I'm going to just tell you a little bit about her. She is a practicing integrative veterinarian. Through the years, her practice has included multiple species. She has discovered ways to activate the body's inherent pharmacy. And this inspired her to pursue some different modalities of treatment, like and she's going to have to tell us what this is, LLLT, VOM, cranial sacral and osteopathy. So she is doing a business that's called Mobility Integrative Veterinary Services. How cool is that? And so she has found by adding this NRF2 synergizer in her practice by using nutrigenomics, she has been able to enhance her toolbox of healing capabilities for animals. And she's been a LifeVantage distributor since 2018. A Pirelli natural horsemanship student. She uses concepts of respecting body language in all species she works with, resulting in an enhanced veterinary experience for all. So we are so excited to have Janet Gordon-Palm, and I'm going to turn the meeting over to you.
Thank you. Thank you, Teresa. Great introduction. I will explain those terms real quickly. LLLT stands for low-level laser therapy, and VOM stands for veterinary orthopedic manipulation. So those are just different ways, again, of activating the body's own pharmacy. And again, that's what's really lighting me up. I've been a veterinarian for 39 years, if you can believe that. The last 10 of which is where a light bulb came on, where I realized all these ways that we were just putting Band-Aids over symptoms in allopathic medications and allopathic medicine. We just were treating the symptoms, and what is causing those symptoms, and what can we do about that? And what can we do about adding building blocks to healing rather than stumbling blocks like we tend to do when we start throwing a lot of pharmaceuticals in? And there's nothing against pharmaceuticals. We've all needed those pharmaceuticals, but how about if we try and tap our body's inherent abilities to have chemicals that are already present, add in the healing cascade, and then we can use less pharmaceuticals, less stumbling blocks, and more building blocks for healing. So the low-level laser therapy is what I was getting into about 10 years ago, and all of the science that has to do with Protandim is so familiar to me because in studying all these different ways our body has of healing, I was able to find that it's very similar. It's all quantum medicine, meaning it's all what's happening at the level of the atom by different things we're doing to activate our body. So the Protandim Nerve 2 Synergizer, how that enters into the picture is if you're looking at, again, a whole integrative approach, a whole holistic approach, we're not only talking about what occurs to our bodies with all the stressors that we have, but also what we're taking in, like Teresa was mentioning, all the things we're doing to ingest good nutrition. So looking at a holistic way, we're looking at the environmental stress, the stress that we may have, the personalities, the things that cause us concerns. So those are stressors that can add and cause toxins in our life. Oxidative stress is termed to be a factor of our body's inability to keep up with some of the changes that occur when our cells interact. Our cells will interact and develop, and we've got byproducts that our body usually gets rid of. And when our ability to get rid of those byproducts, it outweighs the ability to keep up with it, then that's when stress occurs, oxidative stress. And that can be the precursor for a lot of chronic inflammatory conditions. So the Protandim Nerve 2 Synergizer, again, I just want to mention a little bit about what Nerve 2 is, NRF2. It's not the Nerf football, although you can visualize something like that to remember the name. It's NRF2. And what that is an actual pathway that's in the body that all vertebrates have. Now, when I say all vertebrates, we're talking not just humans. We're talking mice and rats and dogs and horses and cattle and goats and even chickens. So we're finding that there's a nerve 2 pathway in all of those species. So again, and a way to activate that pathway is very much a forwarding of healing. And the reason that can happen is with the nerve 2 pathway, again, what it causes is the body has the ability to activate these genes. And Teresa alluded to that. There's survival genes in our body. And when we were children, when we were babies, those survival genes are activated. The nerve 2 pathway activates that to create these enzymes called superoxide dismutase, or SOD, catalase, for some of you science geeks out there. Those are enzymes that are called on to break down free radicals. Free radicals are the stressors, the toxins that our body creates in trying to grow and mature, and it's the cell byproducts. So again, the nerve 2 pathway is in all vertebrates, and what that does is it allows us to create an expression of genes in our body that make enzymes, and these enzymes break down free radicals, and the free radicals are what cause oxidative stress. So Protandim Nerve 2 Synergizer is a combination of some ingredients, which we will go through. At the bottom of the screen, you can see the 5 ingredients. We've got turmeric, milk thistle, green tea extract, bacopa, and ashwagandha. And all of those in small dosages have a synergy, and those synergistic effects are what activate that nerve 2 pathway to cause those enzymes to create the ability to break down free radicals. And the oxidative stress is a result of free radical buildup. So the studies were showing that they actually were able to decrease the free radicals and the oxidative stress by 40% in 1 month of being on the treatment, and 70% beyond that. So if you can have a way of decreasing oxidative stress in the body with 5 herbs, 5 herbal ingredients that actually have little to no side effect, and the only reason I say little to no is there could be sensitivities. People can have allergies to certain ingredients, so obviously be aware and talk to your physician when you are looking at administering this. But again, there are such low dosages that generally they're lower than any type of reaction that people have seen in that combination. So it's generally safe. I've not seen any dog that has had a side effect, any horse that has had a side effect. Humans, I'm on it, my husband's on it, our whole family is on it. Again, we've had definitely improved quality of life as a result. The other thing too to realize is this is actual science. We've got over 20 peer-reviewed journal publications, as you can see, on pubmed.gov. As a veterinarian, this is something that was huge for me. I love the responses that I was seeing, and anecdotal is probably the only way we can sometimes get certain responses before evidence-based medicine catches up with it. But what's cool about the Protandim is there's already evidence-based medicine out there, and that speaks volumes. So again, you can see some of the journals that PubMed.gov has studies coming from. You've got universities and institutions that are doing ongoing studies now. Again, the science is real, the science is there. So knowing that we've got this pathway in all vertebrates, to me, again, and you can see there's patents on a lot of the formulations. Some of this, again, knowing that it's so well known, it's validation for offering it to your clients and to your patients. But for me, it all boils down to risk versus benefit. I want to make sure when I make a decision that the benefit of what I recommend outweighs any and all risks. And so that is true with the Protandim. The benefits that we're seeing, and I think they'll go through more of this with the human model as well, but the benefits that we're seeing is increased vitality. We're seeing better sleep. Again, the ashwagandha and bacopa are studied Ayurvedic medicine herbs for improving cognitive function and mental clarity, sleep. So those are helpful in animals as well. I'm seeing lots of dogs and horses that one of the most common responses that people will see, since again, they can't tell us how they're feeling, but they can sure show us. And we'll see horses being of a lot more vital, usually within about 2 weeks of being on the product on a daily basis. Dogs, I've seen it sometimes sooner than that, but when you combine that modality with some of the other building blocks for healing, like good nutrition, hydration, mental enrichment, outdoor time. My low-level laser therapy is actually non-thermal laser, and so it has been found to stimulate the NRF2 pathway as well. And when I combine those two together, we tend to see more of a adaptive effect, meaning that it enhances each other. And so we see an increased vitality, we see increased and expedited healing of wounds and arthritis situations. We see animals with a lot more fluid movement, again, based on the fact that free radicals are being engulfed by the catalytic enzymes and the SOD, and that decreases the oxidative stress. And remember, oxidative stress is one of the basic precursors for almost any chronic inflammatory disease. So in horses, I've been seeing so many benefits with horses with laminitis, because remember, laminitis is an inflammation of the hoof in the horse. It's where toxins build up. It can cause restriction of blood supply. It can cause painful inflammation. And since the hoof wall is not very forgiving, we tend to see separation of soft tissue and the toe bone or coffin bone, and we tend to see those pull apart, and that can be very, very painful. What's the underlying reason for that? Oxidative stress. What's the underlying reason for a lot of our colics? Oxidative stress. What's the underlying reason for some of the chronic inflammatory diseases that dogs get, osteoarthritis and autoimmune diseases? Oxidative stress. So there's a recurring motif here, and a lot of people will say, how can one pill do so much? And again, it's an adjunct to our treatment in trying to decrease oxidative stress as best we can, giving them something internally, working on some of the factors we can work on in our management, the outside world, trying to decrease stress for that animal, trying to make sure they have good nutrition, hydration, and massage therapies, things that can just help with connective tissue inflammation. And you put all those factors together and it's a no-brainer. We've got really a great way of activating the body's own pharmacy just to help advance healing. So again, I don't know if I have time to talk about just a couple cases too, but
yes, if you would, that would be
awesome. I've been a distributor since 2018. I'll tell you how I got started. Again, this science was very, very familiar to me. I have been studying this with the low-level laser and what it does to activate the body's own pharmacy. And so it was very familiar. And Dr. Rebecca Glasser is an MD plastic surgeon, and she and I had contact one day, and she was discussing this with me as we got to know each other. And I said, I know all this science. So when it was just easy, I was an easy sign up, because I felt that I wanted to do everything I could to help my patients with any type of decrease in stress and inflammation I could do. And this made a lot of sense to me. I didn't really have to do a lot of research. I'd already done the research. So that being said, I just needed to gather some cases. And that was pretty easy too, because I had several horses that had been suffering with chronic arthritis. I had a couple horses with laminitis. And so I've been lasering those horses, and we'd see improvement with the low-level laser and with some of the nutritional management changes. And we've got great equine veterinarians out there that actually have the pharmaceuticals covered, because we do need to get those horses out of pain. We've got great farriers out there. So it takes a village. And so with working with that, what's really fun is what we'll find is when we add the Protandim to that mix, decreasing oxidative stress on a regular basis, on a daily basis, then that's when I started seeing these animals needing my laser less and less. The intervals of my laser treatments can be stretched out now as a result of having what I call my laser in a bottle, with the way that it decreases the oxidative stress. So 2 laminitic horses made a turnaround pretty dramatically. And I also had a horse that actually was a horse that chronically colicked, and we've not seen, again, we were doing, I do the adjustments on the horse to help to rehabilitate at the spinal and connective tissue level, and then also doing the low-level laser to help with improving circulation, lymphatic drainage, decreasing pain, inflammation, putting the Protandim in place, again, as an oral supplement. They can actually wean off of other supplements, which is really nice because that helps decrease their cost long term. So it's really a great adjunct to a lot of the healing modalities I have. In the small animal, I've got some dog patients, and I don't know if we're going to wait and talk about that in the pet tandem. So
yeah, we'll talk about that in a minute. What is your dosage for horses? What do you recommend?
well, the standard dose that I came to know was 2 of the human Protandim tablets per day. So whether you give them both at the same time or divide them, 1 in the morning, 1 in the evening, that's standard. That being said, my own horse is a 23-year-old Arabian. He acts like he's 2. As a matter of fact, I was taking him around on a trail ride, and I ran into a couple ranchers, and he's quite spirited. And I stopped, and we were talking, making some small talk, and he says, "Oh, what's that horse? Is he, what, 2 or 3?" I said, "He's 23." And they couldn't believe it. So I told them what I did for a living, and they've become clients now. So that's kind of cool. But again, the Protandim with him, I only give him 1 a day. So what you might find is for maintenance, depending on the size of your horse, 1 a day might be enough. He's only probably about 14-1 hands, and horse people understand what that is. Average size horses are between 14-2 and 16 hands. So he's a little guy with big energy. So anyway, that's the standard dose. I know I've heard this too, and a lot of the equine vets and equine managers and barn owners and such have been working with increasing the dosing with inflammatory diseases like an acute laminitis. I wouldn't hesitate to increase that dose. And one of the thoughts was 1 tablet per 100 pounds body weight as an initial kind of therapeutic dose, and then you can taper down 1 less tablet each day after that till you get back down to your maintenance of 2 a day. So that's been something that I used it on 1 horse that was really an acute laminitis where I went that high and then went back down again. But again, only doing this since 2018. I don't have a lot of data bank to draw from other than looking and seeing what other horses are on, other equine expertise out there nationally now. Now it's an international company as well. So there's actually, I'm not sure if he's on this chat, but there's quite an elite horseman in Sweden who I invited to be on this today, and he's a distributor in Sweden. They're not quite open in Sweden. They haven't launched it in Sweden yet, but the Netherlands has it, and Europe has it in other areas, Germany, I think, and UK. So it's getting there, but a lot of equine specialists are experimenting with the different dosings. And the cool thing is, again, it's not toxic. We've got herbs, we've got some phytonutrients in there, and the amount that's in each tablet is it's about 675 milligrams of what they call a proprietary blend, which is the 5 ingredients we talked about: the turmeric, milk thistle, green tea extract, ashwagandha, bacoba. So that's 675 milligrams per tablet. So that is, just in trying to decide dosings and such, 2 tablets would be twice that. And we'll talk a little bit more when we get to the pet tandem about using pet tandem versus the pro tandem for large dogs.
Yes. So we'll give the floor back to you, Janet, but I wanted to introduce Tammy Fagan. Tammy is also a horse expert. She's a trainer and an instructor, and she owns Fagan Farms with her husband. She's been doing dressage training since 1986. So do the math, that's a long time, over 30 years. And she lives in Loma, Colorado. So I wanted Tammy to share with all of us. She's had some pretty incredible results with using the Protandem on her horses. So if you want to take it away, Tammy.
Yep. Hi, everybody. Yep. And so what I found out, I of course use it myself and really got results from that. So I had a horse that was having a lot of problems, and got him diagnosed. He had Cushing's disease, and that's not a fun diagnosis to end up having with your horse. And had a hard time riding him. He wasn't staying sound. Things were going to his feet, the laminitis, weight problems. He had huge gobs of hair growth that he wouldn't shed, swelling of his sheath. And he even got pain and funny over his hind end. He would tuck his hind end funny, and I have these pipe corrals, luckily. He would back up to those corrals and just push on those corrals. He's painful, and it was just kind of a weird reaction, and we were trying to figure out what was going on. So I did get him diagnosed. The veterinarian did have me put him on an RX. It's that was called Presend, and I had him on that for 2 months. He had initially some relief from that, and then he had, after about a month, a little over a month, his sheath swelled really bad. And so if the male horse's sheath swells, they can't urinate. And so I got worried. It got to that point where I was worried he couldn't urinate. So that seemed to be kind of a reaction for him. So I had to take him off of that. And so it was a perfect opportunity for me to put him on the NRF2. And he is a 17-hand horse, so he's very large and very heavy. And I put him on 3 tablets a day, 2 in the morning, 1 in the evening. And he was on that for a little over a month, and he started shedding all of this horrific hair off. I mean, like crazy. It just, I couldn't believe how much hair came off of him. So he was shedding ahead of the other horses. This was in, must have been the middle of February, he started shedding. But this horse would sweat. He was so hot, he couldn't function very good. And so he lost all of that hair, and the fat deposits have went away. He's just much healthier. He's quit leaning on the pipe fence with his hind end. His hooves are doing better. I'm starting to ride him again, and he's staying sound, and he's feeling good. And I'm just so pleased with what's happened with him. And I actually have even reduced the dosage then to 2 a day after that initial month and a half, 2 months. And so he's doing really well on that. And that's been, since March. He's on 2 tablets. He's just continuing to feel better. And one of the other things I noticed here just lately, now that he's been on it for several months, is his anxiety level. And so I think with the Cushing's, that anxiety is there too, and that's decreasing. And so he's much happier. He's not stressed out. He's feeling good. So I'm just super pleased.
That's so awesome.
Yeah, and I actually put another one of my horses on. When I took him down to 2 tablets, I put my mare on last year. I just put her on in March, but last year she had a terrible heat cycle that she just stayed in heat all the time, and she got really painful in her back, and she was a mess. I had to quit riding her. And this was a horse that was showing very successfully, and bringing her up the levels. And so I had to just quit riding her. And I put her on this, and she has not gotten into that weird heat cycle this year, and is been riding her again, and she's actually has a hard time gaining weight and muscle, and she's doing better. It just seems to know what they need. It's just an amazing thing, because she's just gaining muscle and looking better that way. So I'm super pleased with the results on that, on a whole nother issue.
That's great too. That's awesome.
Yeah, yeah.
Yeah, and so I have someone else on. Val, you're here, right? I can't see you, but I see
I
you.
am here. Yes, I am. Yep, I'm here.
Okay, so Val Helfrich is a coworker of mine. At least she was. She just retired recently. How exciting for her! And she is also, I think, her side hobby, or maybe not even a side hobby, but her hobby is animals. She's a longtime horse person, loves animals, and is a LifeVantage believer. So I know you have some incredible stories as well, Val. Do you want to share those?
I would love to. Thanks, Therese, for that very kind introduction. Um, I have a 23-year-old mare that for probably the last 5 years, we had struggled and struggled with her because she foundered very badly, and founder is sort of the more common name for laminitis that Dr. Janet Gordon-Palm was talking about. And I thought, I'd give her a shot. When my husband and I went on the products, we had a very dramatic response very quickly. And, you get that idea in your head, well, maybe it's in my head. So I put my dogs on it. My dogs had a very rapid response. So I thought, the horses are out in the barn. They don't know what we're doing. So we began taking a little chunk of apple, hiding Protandim in it, the human Protandim NRF2, and giving it to Lola. Now, Lola had also almost, I would say, once a week colics, which is where they get a lot of gas in their stomach, and there can be a potential for the stomach to twist on itself and cut off the circulation to the intestines. So it's a very, very serious kind of gas. And we used to go through a tube of the medication known as Banamine, probably at least one a month. And I was checking it the other day, and I realized I have gone through 1 tube of Banamine in the 2 years that she's been on it now. So it's been just an incredible response for her. Of course, when you have a pet that you love, you want them to be happy and healthy. And she's doing so well that she's going to be coming out of retirement. I've been working her in the round pen, and she's looking fabulous. Kind of like Dr. Janet Gordon-Palm's story. Some horse folks were over here, and we were talking, and they said, well, how old's that big mare of yours? Because she is a heifer. She's a big girl. And I said, oh, she's about 24, 25. And they had her pegged at about 12 or 13. So she just looks spectacular. She's feeling good. And we're so, so pleased to have those results.
So Val, we're going to get in a little bit more with dogs in a minute, but did you want to share, while you have the floor, your dog story?
Well, I have a lot of dog stories, so I don't know which one you want. A couple of them might not be quite ready for prime time. But my now 8-year-old bull mastiff, when he was about 4, developed a limp, and he had some hip dysplasia. Mastiffs age a lot more quickly than other dogs, and we all think our dogs age too fast, but mastiffs really do age very quickly. So we had to start him on a prescription medication known as Rimadyl, which helped him enormously. It was great. But he got to the point where we were doing blood work, and his levels were starting to rise. So it looked like he might not be able to stay on Rimadyl, and there's other stuff. He was also on Cosequin, I think is what it's called for dogs, which honestly, it may work for some, but it didn't seem to work for my guy. And as I said, when my husband and I had rapid response, I thought, we'll try it on the dog. I did start him on the pet tandem. He's a big guy though, so I switched him over pretty quickly to the pro tandem. And within 2 weeks, I had him off all of the prescription medications. He has not needed them again. He still races around the house. He just had his 8th birthday on Friday. And he still does the puppy zoomy where he flies through the house. And we have to duck, run, take cover because he'll run you down. So I also did start him on another product that we have called Probios, because another thing Mastiffs are famous for is flatulence or gas. And Remy could clear the room, the house, the county, I believe. We put him on that, and honestly, it's extremely rare that the dog makes us leave the room for that problem. It's been very remarkable, and I think it's interesting to see that, you know, it can help anybody. Everybody needs a good gut. We know that for our immune system to work fully, but it's just great to have this great response for our baby.
Thank
So
you
thank
so
you.
much, Val. And so, you know,
Oh, you're
hearing all these incredible stories about animals, well, we don't have a placebo effect. You know, humans, we can take something and think it's going to make us better, and it actually does. And like Val was saying, you know, she was feeling better, but she's like, am I just imagining this? But pets, they don't know. They don't know. So when we see this improvement, you know, this is real. And reducing oxidative stress is huge. And we know that it will reduce oxidative stress by 40% in humans within 30 days. So extrapolating that data to animals, I think, is very safe to do because they are mammals as well. But what experts, and I think Dr. Palm can alluded to this already, but what I had heard is that it usually takes about 30 days to see a result with horses, sometimes sooner. And with dogs, it's usually shorter, like 2 to 3 weeks. So I just want to really quickly let you all know that, you know, these products are designed for humans. We have other products that that we can use. One is, you know, NRF1 synergizer. So NRF2 is a naturally occurring pathway in our body, and so is NRF1. NRF1 is focused on mitochondrial health. So if you remember back in high school biology, you know, what are the mitochondria? The I can't say it, the mighty mitochondria in our cells. Well, they're what makes energy. And ATP is the type of energy that our cells makes. As we get older, our body is less efficient at producing energy. We get tired, we don't sleep as well. And so this NRF1 synergizer is also made up of 5 natural occurring ingredients: alpha lipoic acid, coenzyme Q10, grape extract, quercetin, and acetyl L-carnitine. So, and the thing with both of these, the NRF2 and the NRF1, that you have to realize is that it's not each one ingredient that's working to make these changes in our bodies. It's the synergistic effect of these 5. The same with Protandim NRF2. It's the synergy of these 5 that activates this pathway. And so the NRF2 and NRF1 are our 2 synergizers. We also have a probio, and Val was talking about putting her dog on it and what incredible effects she had with her dog. I can't say that I've had that effect with my ProBio, but it is a crucial thing to have a healthy gut. And we're finding that our gut health is related to our mental health. More and more research is showing that. And the other really, really important thing with regards to gut health is that 80% of our immune system, our immune cells, are made in our gut. So, you know, how important is a good immunity right now? Crucial. And the mental health, gut health relationship is because some of those brain neurotransmitters, such as serotonin, dopamine, are also made in the gut. So it's crucial. And our probiotic has a 60% efficacy or effectiveness compared to, you can't see it very well in this slide, but this is actually a 4% effectiveness with most other probiotics, because we have this special biotract coating that actually protects and gets the probiotic to the gut, does not get destroyed in the stomach, which most probiotics that you buy at the store, that's why there's only a 4% effectiveness, because they're destroyed in our stomach. And so you know, personally, I mean, I told you, I still have gas, I'll tell you that, but I've had many, many improvements with my gut health, many, and I have had some really fantastic results from some other clients of mine. The omegas are fantastic as well, and this is just our fish oil, traceable from boat to bottle. We have omega-3s and omega-7s, which are very, very good omegas. The omega-6s that sometimes you'll find in other fish oils are just, they're not good for us. We don't need them. They can cause inflammation. So omegas are important for our heart, our skin, our brain, and here's that healthy immune system again. We also have a little bit of D3 in our omega, so this is also a great product. So the 4 products that I've mentioned comprise our Vitality Stack, and the Vitality Stack is really, you know, for us humans, the thing to take, because it just gets so many different systems and helps us. And so we want to be healthy so that we can raise our healthy animals. And so we do have other products. We have an energy drink. We have a wonderful weight loss system, skincare that uses this NRF2 technology. There's no other skincare line like ours. And we also have a hair care system that is really amazing. I love the hair care system. But I wanted to turn it back to Janet Gordon-Palm, because we also have Pet Tandem, which is NRF2 for dogs. And I just want you to talk a little bit, Janet, about why Pet Tandem versus Pro Tandem. When would it be appropriate to use one or the other?
Sure. Thank you, Teresa. As far as the Pet Tandem goes, the same active ingredients are in Pet Tandem as are in the human NRF2 product. Again, those are the turmeric, milk thistle, ashwagandha, green tea extract, and pacoba. So those 5 ingredients are present. And as far as the milligram strength, just to give you some perspective, in the human, we talked about there being 675 milligrams of that proprietary blend. And in the Pet Tandem, it's 150 milligrams of that blend. So it kind of gives you an idea that 1 full tablet of the Pet Tandem contains about a little bit more than 1/4 of the amount that 1 human Pro Tandem is. So the Pet Tandem has other ingredients as well. Besides the proprietary blend of 150 milligrams of the turmeric, milk thistle, ashwagandha, bacopa, and green tea extract. There's about 120 milligrams of omega fatty acid. So there's just a little bit of fish oil in there, and about 125 milligrams of a collagen that's sourced from avian sternum. So like probably chicken keel bone or something. So that collagen and that protein are helpful for a lot of dogs for skin and coat issues, as far as with the omega fatty acid too, as well as it's got bacon, smoked bacon flavoring too. So again, it makes it a lot more of a treat for dogs, whereas the human protandem with the turmeric in it is pretty bitter, and usually you have to really mask that. So why go with one or the other? So with a pet tandem, you'll find dosings on the back of the bottle, but one tablet is generally for a dog that's probably about 11 to 29 pounds, 11 to 30 pounds. And so that's one full tablet. Under 10 pounds, probably between 8 and 10, you'd probably go half a tablet, and then a quarter tablet would be for the tiny little micro dogs and cats. We give this to cats as well. And I'll tell you a little bit about a way to get cats to eat this, because they're very, very finicky, even more so than many dogs. So again, with those blends, it's really helpful for dogs for multiple issues besides decreasing oxidative stress. However, because of the poultry and the chicken that's in it, when there's dogs that have allergies or atopic dermatitis, which is like an ingested or inhaled allergies, I many times will shy away from the pet tandem because of the poultry, because some dogs are allergic to chicken. So it's helpful to know what your animal is able to tolerate, because if you were having a reaction to the poultry, I'd hesitate to have owners feel that the pet tandem wasn't helping. So that's why, again, we screen the animals that go on these products. So dogs that are over 30 pounds can take more than one pet tandem tablet. Again, it's about a tablet per 30 pounds, if you look at it that way. So a dog that's 70 to 90 pounds might be taking 2 to 3 of the tablets, 100 pounds, maybe 3 to 4 tablets. So that becomes maybe a little bit more of an expense for some owners too. So knowing that the active ingredient of the human protandem is a little more concentrated than the pet tandem, dogs that are over 50 pounds, some owners will use the human protandem as well, and instead of the pet tandem. So it becomes an option. So some owners and some veterinarians will advocate using both. So if you've got a large breed dog, sometimes just one of the pet tandems and maybe half of a human protandem, just so you can get a little bit of the collagen in there. So again, there's quite a range of options, and each one is okay. Again, it's really helpful to know what you're dealing with, getting the veterinarian's input on some of these additions. Definitely, I want people to know that they probably should advise their veterinarians when their animals are on any kind of supplement or product, because it's helpful for them to know what is going on. And especially if you're seeing dramatic improvement, like I've seen on many of my patients, it's nice for the veterinarians to know what this animal's on and enlighten them to these possibilities as well.
Do you want to mention what you were telling me yesterday about Amazon and your client?
Mm-hmm. Thank you, Teresa. I was going to get to that because that's very important. And one conversation Teresa and I had yesterday when we were talking about the pet tandem and a pro tandem is it's very, very tempting for owners to shop on Amazon. That's where they're getting everything, especially during COVID. Everybody's getting everything from Amazon. And I get lots of things from Amazon that are books or CDs or things like that. But any kind of supplement, any kind of product that you put into your mouth, I would never, ever, ever get on Amazon. And the reason being, there has been many, many situations where products have been called out because they've been fake products with original packaging. So sometimes packaging is being sold to nefarious sources that will put product inside those packagings that are not the product at all. And I had 2 situations when I first started doing this. I was prescribing the pet tandem for 2 different dog cases, and I've just, again, almost everything goes out of my hospital with some recommendation for pet tandem or pro tandem. So just two of these are ones that I became aware of. And one came back to board and told me that they were almost out of their pet tandem and they didn't think it was going to last. And I said, well, here, I've got some, let me show you what I've got here. And you can certainly purchase some of mine. And she looked at the tablets and she said, that doesn't look like what I've been giving. It's not the same color. And so that's the red flag. Just be aware that LifeVantage only sells to their distributors. So if you know of a family member who's a distributor, get it from that family member. If you don't have a distributor, get it from someone who is a distributor, but definitely don't order from Amazon, because it's not that expensive when you've got a product that decreases oxidative stress like this does and minimizes symptoms of certain chronic diseases. But what it is expensive is if you've got a fake product and you're spending that kind of money and not getting the benefit and not feeling that you're going to have the results. So that's my red flag, is definitely do not go to Amazon or a third party, any third party. Make sure you go to a distributor, hopefully a family or member or friend, but definitely a distributor. So the other thing I was going to mention, I've just got a case. Almost every one of my cases are on this, and they do really well, and then especially with the low-level laser therapy and all the other integrative things that I do. But a couple cases in particular. One was a little Schnauzer, 7 years old, that had leaky gut syndrome, had digestive issues for 7 years, was living on metronidazole, which is an anti-inflammatory antibiotic for anaerobic bacteria, and it can help to calm digestive issues. But the dog was living on that, and also on Serenia, which is an anti-nausea medication, and the owner every day would just plead with the dog to eat. Sometimes she would, sometimes she wouldn't. So this was 7 years. I started with laser therapy on her with my non-thermal laser, and the dog was improving quite dramatically, but she kind of reached a plateau. And then I became aware of the pet tandem pro tandem. I'd met Dr. Glasser by that time and started advocating it myself. And this dog turned around, and this dog still comes in for laser therapy, but we've weaned her away to about every month. She comes in for a tune-up, and she's on this pet tandem. She's taking the pro tandem because she's an allergic dog. So we've got her on a quarter of a pro tandem. She's a small little Schnauzer, a quarter of a pro tandem once a day, and she is just doing phenomenal. She's eating well. She's been off of metronidazole for the 1.5 years that I've been giving her the pro tandem and the laser treatments. So it's pretty dramatic. This woman thinks this gave her dog's life back, and hers as well. And then all my old dogs that have arthritis, people feel that they're just having a new lease on life, which is really incredible. Cats. So with cats, just one real quick tip for cats. Cats benefit from this dramatically. I've got so many kitties with chronic immune system diseases, those snotty kitties that always have chronic respiratory issues, asthma. Nerve 2 has been found to be beneficial in humans for COPD and decreasing lung inflammation. Does the same thing for animals. And so with cats, the difficulty is trying to get them to take it. And I'll use either pet tandem or pro tandem too. Both of them will work. With the pet tandem, it's no more than a quarter of a tablet. What I have people do is take the quarter of a tablet, and it breaks off pretty easily. Put that in a Ziploc bag and crush it up into a fine powder. Then I have them take their finger, touch it to the powder, and what sticks on their finger, sprinkle it onto a very high value treat, not ever their food, because you never want a cat to stop eating its own food because something's tainting it. So if you can put either, I use bone broth a lot. A lot of kitties like bone broth, so have them sprinkle a little bit of bone broth. Sometimes you can put it in real butter, not margarine. It has to be real butter, the good stuff. Cats know the difference, or coconut oil even, and allow the kitty to, you can just put that kind of smeared on the lips and lick it off. If they taste turmeric, they'll start foaming and frothing because it's pretty bitter. So that's why with the pet tandem, I think that works well. With the pro tandem, I've had an owner share her own pro tandem with her cat, take half a tablet, they break in half easily, put that in a Ziploc bag, crush it up into a fine powder, and it can't just be granules. You have to do it in a fine powder because kitties, they can feel the texture. And then same thing, finger, sprinkle it onto something high value, canned food, whatever, something different than their own food, and then give that to them once a day. And again, that's been really helpful. I had a kitty with chronic urinary tract issues where every day for 2 years, this cat had straining to urinate. Never had stones, never was obstructed, just chronic feline lower urinary tract disease. A lot of times that's stress induced, an immune system. And we put this kitty on the Protandim and a water fountain for the household because kitties like to drink running water. And so just the increase in water consumption and the pet tandem, she's on the pet tandem powdered once a day in bone broth. So again, you can see why we're so excited about this. Horses, dogs, cats, obviously humans. I can't wait to do some more anecdotals on some birds, knowing that chickens also have nerve too, so we know other birds would too. I'm a member of the Association of Avian Veterinarians, and so I've got access to people that do have lots of birds that have chronic issues, chronic feather picking. I mean, we can see the possibilities here. Oxidative stress is the underlying reason for just about everything that's wrong with our lives. And so if we have a tool that can help decrease that, then that's, again, something where we can activate our body's own pharmacy and be more proactive in our own healing. So anyway, thank you very much for letting me go on and on.
Well, thank you. And, you know, we're running out of time, so I want Annalie to kind of close this. And if you just want to tell me what slides you want to go to, but Annalie Cunningham is my mentor for yoga. She introduced me to teaching yoga, how many years ago? 25 years ago. No, maybe, yeah, about 25 years ago. And so she has been involved in the yoga, dance, and movement industry for 30 years. She loves to educate people. She owned a studio for many, many years, but stopped that in November to really focus on this business, and has been in LifeVantage now for 4 years and is doing really, really well with the business as a Pro 5. So
thanks, Therese. Wow, what a great, thank you everyone for the presentation. I won't take time to really talk about my story. I do have a personal knee story, and you can get tagged on Facebook if you'd like to. That's the reason why I'm in business. I do have an animal story, but again, we've heard such wonderful stories. I want to, we'd be remiss if we didn't tell you my part of oxidative stress right now can be part of our stress management and emotions during the times. So for me, this business right now at this time in my life, knowing that I don't have a studio or one-on-one work has reduced my oxidative stress level immensely. And I think that we now have a tool, you can see on this Zoom, that it's easy to invite people and present. So you have to realize this company started as a biotech company. So NRF2, it's been since 2003. It was the only product, and it was actually being sold retail. So between 2005 and 2009, the company was going to go bankrupt. It's like every GNC store only sold half a bottle, once a month. So they hired a business consultant, and basically it was deemed that they should go into direct marketing, which is why we get to build a team and share it the way that we do. There is so much depth and science in this product, and stories that people want to hear. So direct marketing took it from $3 million a year to where we are in 2019 at 250 million. We're publicly traded on the NASDAQ, so that's therefore the science and the compliance is high. That's therefore our patents and the things that we say have to be compliant. We have the most amazing leadership as well. So go ahead, Therese, and go to the next slide. We're in 26 countries and soon to be in over 100, because it's everywhere this is common. Our health, the animal health, our human health, and the business health. So it becomes a place to grow. We are expanding rapidly. Let's go ahead and go all the way to network marketing. Let's just go back to the one before that, just so people know how big. So network marketing, the reason why this is important, whether you are here to hear about animals or human health, but this is part of where we're at now. If part of your work can be at home, makes your animals happy too, right? So network marketing is in global billions. It's become, right now at 2020, it's close to 200 billion. It covers every market, including animals, which is why we're here tonight talking about animal health. Our company is compliant and we are traded at the NASDAQ. So therefore we do publish our earnings. So that's what I wanted Therese to turn to now. And it's kind of hard to see if you can. So like I said, what's so important to me, going from having a studio where I was teaching classes and serving people one-on-one, closing it and starting LifeVantage 4 years ago. Number one, started from my knee and back health in arthritis. It's turned out to be this year, 2020, where I am at Pro 5. So what you're going to see here on the left is the distributor rankings and what is the average that we publish made. So Pro 5 is about 3,000. I started there. But as a beginning distributor, if this becomes something that you want to share the way we did tonight, Pro 3 is, do we have anyone on board at Pro 3? Therese is a Pro 4, so at $1,500, it's worth it. If you come in as a Pro 3, if you build up to Pro 3, $600 right now at this time is pretty nice to have. So what I want to say about this business is that it's easy to, you don't have to talk about the business. We bring our experts in. You don't have to talk about even the science. You don't have to know everything. What's really nice is that the tools are here. Go ahead and Therese, you can go all the way to the timing. Oops, we missed the timing one there. So
this one?
Yes, yes. So what's really important, I'm just going to quickly run through LifeVantage. If you can look down below where that purple asterisk is, that's branding. Branding that's at about 600 million. We are at 250 million, so we're below that. What's really nice about that is there are companies that haven't that have already reached, like the Mary Kay and the Pampered Chef are all the way at the top, where they're growing 4%. What you have to realize at branding, at where the star is, 80% of the momentum happens. It's called the S curve. And the timing is so important right now in our honest approach to gain health. A healthy approach is also to be in a business where you can ride this wave and have growth potential. So right now, if I want to say I want to jump on the wave, this 80% growth is very attractive to me. And it's important to know that you can't put all your eggs in one basket. If we can improve the lives, our lives, if we can improve the lives of our animals, and we can improve our financial health, we're never going to have to, we're making an investment of time and effort to create a second source, or that source that becomes so important right now. So wherever you joined us to hear about animals and to hear about oxidative stress in humans and the business opportunity, I'm going to hand it back to Therese. And Therese, you can close or route it to anyone else
Um,
who needs to speak.
Well, if anyone has any questions, in the audience for Dr. Janet Gordon Palm, if you want to unmute yourselves in the upper right-hand corner on your screen, and I'll just let, if anyone has any questions, we have a few more minutes.
See.
All right. All right. Well, I just thank everyone, and especially all of our presenters, Janet, Annalie, Tammy, and Val, for participating, and thank everyone else for listening in. And if you have any questions, you can get with whoever invited you to this webinar. And have a great evening, guys.
Thank you.
Thank you.
Let's see.
MSNBC and CNN. ABC. Yes. Fox News. Yeah. I love you.